Then suddenly, of course, in between what happened is sometime in 1952, I fell ill, seriously ill. I had a bout of tuberculosis. Those days, TB was something like the attitude of people to cancer. So as soon as somebody says he has cancer, you almost write him off. Poor fellow. Like that, in those days, TB had no big treatment or anything, no drugs, nothing. The only known method of cure was to have complete rest and good food. Uh, Antibiotics had just come in at that time. 1947-48 is when India got antibiotics. But there was no antibiotic for TB as such. So the treatment given to me was, we employed one doctor on monthly salary, 200 rupees a month, to come and visit me regularly and as often as is needed. He had to decide how often. He used to come every 2 days in the beginning. And then we were in a very small house in Hyderabad, in Hyderabad, in the center of Secunderabad. There were a lot of people in the house, about 8 adults and 2 or 3 children. And it was decided it was safe for a TB patient and all these people in one small house. So we went out of Secunderabad to Tarplaka.
Huge house.
Yeah, there was a huge house where I could be given a separate room with a separate toilet, isolated completely. I used to pay the rent for that house and the milkman, because I used to drink a lot of milk in those days. Those two expenditures I was bearing. The rest, my brother was running the house for the rest of it. So that I was ill. I was completely bedridden from about 52 March to the end of, I would say, till July.
Oh, okay.
I was just lying down, that's all. It's funny how I arrived at this decision that I was having TB. I was falling ill very quickly with fever. I used to get fever for a half a day or so, and then I would become all right. And every time I got fever, I used to fast. I would not eat it. So it made me even weaker.
Okay.
And then I started coughing. Every little effort I used to cough. And I had a doctor, family doctor, Dr. Iyengar. He was also from Nellore, family friend. And he was giving me penicillin every time. I was not satisfied with the treatment. So I myself, without telling anybody, went to a ENT specialist. Because I was getting cough very often. I wanted to know if anything wrong with my throat or something. Then he told me that my ear, nose and throat are absolutely all right. Why don't you go and see so and so doctor, Dr. Wagre, see if your chest is okay. When I went to Dr. Wagre, he told me your lungs are infected, you are having TB, and immediately he gave me a medicine also for it. Para-aminosalicylate acid, PAS, granules. You are supposed to take those granules and put it in some milk or something and drink 2 or 3 times a day. Then I told my brother Anandam that just be to Wagre and this is what he told me. So immediately there was no X-ray or anything.
No, that's
Tested.
no X-rays.
Even without an X-ray, the doctor told me that. But anyway, we went to the X-ray radiologist, and he took the X-ray of the lungs, and he called all of them to the backyard of his clinic. He asked me to sit in the patient room and took him away. And I took some 10 minutes, now nobody came back and anything. I knew what was wrong with me, so I was not, he was afraid to tell me something. So he was telling my brother Anandam. So when they came back, I told him, you think I am having TB, right? He was surprised. So anyway, the treatment then was, they used to pump a lot of hair in my left side from here, a long needle.
Oh,
It
yeah.
was pierced into the here inside the rib cage. It pumped air that would collapse the lung. Left lung was the one which was infected. It will collapse the lung and takes rest. It does, when you are breathing, it doesn't do this.
Okay.
So it remains idle. When I tell the doctors, no, that is the treatment I got, they say, wow, what sort of cruelty was that?
Never heard of it.
It's called AP, yeah, from air pumping, I suppose. Or it may be a Latin. So. And in those days, streptomycin was the strongest antibiotic known. So doctor gave me that also. Actually, it had nothing to do with TB. That was discovered later. But he gave me streptomycin also. I had 72 injections of streptomycin for the year. And this thing first started every 2 days. Because the air pumped in used to leak through that lesion in the lungs where it was infected. They were full of holes. If that air would come through my mouth, it's not as if it comes in with great pressure or anything, but it just leaks away. So every 2 days he used to give it. And I used to find whenever the doctor came, there used to be a lot of tension in the house. Although I never felt anything. Apparently, what was supposed to be what do you call it, a very crude treatment. That's what people say now. So March to July I was lying down. I never went to the university. But I sent a sick leave letter to my professor, Dr. Bhargava. He kept it with him. The university reopened on 1st July or something like that. I went to the university on that day, quite ill. Then he asked me, when did you start, when did you start your leave? I said, some date in March. Were they not preparation holidays? Yes, sir. At the time I was temporarily a lecturer.
Okay.
Oh, okay.
One fellow who was teaching electronics, he got a job in Dehradun, the military college of engineering or something. So he went there. So in his place, temporarily they asked me to teach electronics to them. So I was temporarily appointed lecturer. And I had to teach electricity to the BSc students and electronics to the MSc students. And the college closed sometime early March as preparation holidays for the university exams. So there was no teaching or anything. So they were all preparation holidays. Then you had summer vacation. So why this leave letter? He tore it off with my own.
Oh, nice.
Because I didn't have to apply for any leave. After July, he gave me some 15 days, 1 month leave. And then he told me, you come every day for some little time and go back. So I used to go to the university for 1 hour. My house used to be very close to the university. My brother used to drop me in the university, and after 1 hour I used to get back. I was not doing any work, so just going and coming. So my presence was there. Like that I continued up to the end of that year. And by then I had become almost all right. Doctor told me I can now start working, but be careful, don't exert yourself, something like that. So I started again my work as a senior research assistant. This went on. And it was in 53. Dr. Bhagavatam told me, Krishnamurthi, if you want to continue in the academic life,
You have to do.
you better have a doctorate.